So I hear the guidelines have changed for Pap test. Is that true?
It is. Secondary to some recent data that's been released, the guidelines have been changed in order to expand the interval between Pap tests. The guidelines now state that you do not have to have a Pap smear until the age of 21. At the age of 21 to 29, a Pap smear should be done every 3 years. And then from the ages of 30 to 65, the Pap smear can be done every 3 years if you have a Pap test alone. It can be done every 5 years if you have a Pap test in conjunction with an HPV test. After the age of 65, you no longer need Pap smears unless you've had an abnormal Pap smear in the past.
So what is an HPV test?
An HPV test is a test that looks for high-risk types of the human papillomavirus in the cervix. If you've been exposed to the human papillomavirus, in many situations your body just clears the virus all by itself. However, in some situations, if the virus persists in the cervix, then it can lead to cellular abnormalities in the cervix, causing abnormal Pap smears and putting you at increased risk for cervical cancer. The HPV test helps to identify patients who have still persistent high-risk HPV in the cervical tissues who may be at increased risk for cervical cancer.
So the recommendations say that you can stop at age 65. So when I turn 65, I don't have to worry about going?
If you've never had an abnormal Pap test in the past, or even in the past 10 years when you get to 65, then you can stop having Pap smears in the future.
What if I've had a hysterectomy?
If you've had a hysterectomy, it really depends on the reason that you had a hysterectomy. If it was for a benign reason, like abnormal uterine bleeding, endometriosis, or fibroids, and your cervix is removed in that hysterectomy, then you don't need Pap smears anymore. If your cervix was left in, then you still need to have Pap smears. And if you've ever had an abnormal Pap smear, even if your cervix has been removed, you need Pap smears in order to detect a vaginal cancer early as well.
So basically I don't need to see a gynecologist anymore if I've had the hysterectomy and I don't need the Pap test?
Well, seeing your gynecologist annually is a good idea in order to have your breast exams, to make sure your mammograms are ordered, to have a pelvic exam annually to look for any other problems in the pelvis, such as an ovarian mass if your ovaries are still in, and also just for general health maintenance.
Right. So, you know, no one wants to be diagnosed with cancer, so that's part of why it's important to come and see you to continue health screenings.
That's true, and while no one wants to be diagnosed with cancer, and some are fearful of even going to physicians because they don't want to be diagnosed with a problem, getting something detected earlier increases your chance of survival from a potential malignancy, and getting the appropriate screening is recommended to help improve your chances of survival so you'll be around to take care of your family.
Great. North Fulton Hospital is proud to offer complete women's oncology services. If you need to schedule a Pap test or an annual exam with a gynecologist, dial 770-751-2600. I'm Micah Brown for Checkup for Chicks.